And welcome back. Albert Einstein College of Medicine researchers were recently awarded a 5-year, $3.5 million grant to study the effects of COVID-19 on the brains of adults who had mild or asymptomatic infection. Joining me now and sharing more details is the Associate Director of Einstein's Gruss Magnetic Resonance Research Center and Medical Director of MRI Services at Montefiore Health System, Dr. Michael Lipton. And then we're also pleased to be joined by the Professor of Medicine and Microbiology and Immunology at Einstein and Infectious Disease Physician at Montefiore, Dr. Johanna Daily. And we thank you both for joining us here on the show.
Thank you.
Great to be here. Thanks, Daren.
Well, I understand that you're studying brain changes that are caused by COVID-19. Can you give me a little bit more insight as to why you found this to be so necessary?
Well, maybe I'll start with that, Daren. I'm an infectious disease physician, and when this pandemic arrived in the Bronx, February, March of 2020, we were really focused on saving people's lives. This virus was causing a high mortality rate, and we got through it. We got the vaccine, we have some therapies now, and now what we're noticing from our patients, including those who had just mild COVID, that they're reporting a plethora of symptoms, everything from palpitations, not able to exercise as well, maybe some feeling like pins and needles in their skin. And then they're also complaining of problems with memory, focus, a mental fogginess. And we're now starting to study that complication. And as an infectious disease doctor for 25 years, I have to say this is sort of an unusual long-term complication of a viral infection. So I think there's something very new going on, and we need to understand it, both to quantify it, who is it affecting, or certain people at risk, and are there treatments for this? And sorry, go ahead.
No, go ahead. You're good. I didn't mean to cut you off. Go ahead.
And Michael can, provide his insights into why we were doing this study.
Yeah, because Dr. Lipton, in understanding, a lot of research has gone into COVID-19, and we know that your study is a little bit different. So can you give us a little bit how this study is different compared to others?
Sure. So we know from pretty early on in the pandemic that COVID-19 was associated with some very severe effects on the brain. All kinds of people were coming in with stroke that shouldn't have had it. There was inflammation in the brain, and there were some other changes. And now with the people who were hospitalized with severe COVID, we see that they have, as Dr. Daly just mentioned, these long-term problems. The question really that we're asking is different in that we want to understand whether having the infection, even if you weren't symptomatic or weren't so symptomatic, could be creating similar problems in the brain at a lower level that people might not realize exactly what is going on. And those are problems that might actually accumulate over time. So what's very unique about this study is, on the one hand, that we're looking at people who were not so sick. But on the other hand, we are looking at a unique group of individuals, mostly residents of the Bronx, who we studied before the pandemic. So a key unique feature of this study is that we're taking people on whom we already have a very clear virus ever existed. And we can then look at how things may have changed in the brains of these individuals, whether they were never sick and they just had the stress of the pandemic, or they had an asymptomatic infection, or maybe they were symptomatic but weren't so ill. So that baseline is really a key feature, because we can see subtle effects that may be causing problems now, or maybe something that could be a problem in the future.
So how do you go about conducting this study? What will the study actually entail?
So Dr. Lipton, as he said, he's been studying young, healthy people in the Bronx, and he has baseline measurements, which is absolutely critical, because any change we see, we're going to feel more confident that that is from having the infection. So we're going to go back to his cohort of about 800 Bronx residents who participated in the study. before the pandemic and invite them back. And they don't have to have any symptoms. They're just going to have had COVID, have not had COVID, or just be colonized. And then we're going to repeat a lot of the tests that Dr. Lipton already had, neurocognitive tests and neuroimaging. And we'll do that 3 times over 3 years. And that will answer 2 questions. What are the actual measurable differences, and how long do they last?
And so when we take these tests, or when they take these tests, I should say, the question will arise as to how do we know specifically that it's COVID? Because over the course of years, there could be somebody with a different health ailment. How are we so certain that this will actually attribute back towards COVID?
Yeah, that's really the key question. And I think that there are at least 2 important pieces there. One of them is it really due to COVID as opposed to maybe some pre-existing problem? And that's why having the baseline is important, because we know in all of these people what their brains looked like on MRI. We know what their brain function was like from a whole battery of tests. And we even have blood samples from before the pandemic, and we can see what change has occurred. So that's how we really address the idea that this might have been there before. We can be pretty clear that what we see is a change. The other question is whether it might not be the infection, but it might have been the experience, the stressful experience of the whole lockdown and the pandemic. And for that, it's really important that we're not only interested in following individuals who had COVID. It's very important for us to also find people who didn't have COVID and look at how they managed over that period of stress, because stress has effects on the brain, on the way the brain will look on MRI, on the way brain functions and people's symptoms. So by having these different groups of individuals, infected or not infected, and following them over time, we're hoping to tease apart the sort of pandemic experience effect as opposed to that plus the COVID effect. And, identifying who was infected and who was not infected is not trivial. That's a really important part of what we do. And that's really Dr. Daily's expertise. We're going to be leveraging some pretty sophisticated testing on these individuals to understand whether they really were infected or not.
Yeah. When you talk about stress, I know that's a part of it too, identifying people who were stressed during COVID-19. How do you go about identifying stress, if you will, because how does that show up in your study, if you will, when you do this research?
Right. So we actually use some very specific and extensively studied tests, psychological tests that look at the effects of stress, that look at the effects of isolation and loneliness, and we assess things including brain areas that we know are in particular affected by stress, and especially chronic stress. So we can get a sense from the way somebody responds to the testing, as well as what things look like in their brain, whether there is evidence that they had a greater or lesser degree of this chronic stress during that period of time. I mean, as you say, different people will have experienced the same epoch of isolation differently.
Yeah. Dr. Johanna, in all your research so far, anything so far surprise you that you could tell us about what you've learned through this COVID-19 pandemic?
People's resilience. I was on the wards in 2020, 21. I have to say, you just saw the nurses and people pull together. That never gets on TV, but the resilience was mind-blowing. The bravery of patients was mind-blowing that were going through it and their families. And I think at that time in 2020, we were collecting patients' plasma from people who had recovered, and the community really responded in terms of donating their plasma to try to treat somebody with severe disease. I guess I shouldn't be surprised, but I was able to witness really the resilience. In terms of this infection, I think, as I said earlier, to see these unusual complications weeks to months after recovering from a viral illness, which we've all had many over our life, that is striking to me. The other thing is we still don't have a handle on what is causing these long-term complications. Is it there's still hidden virus? Is it that our body is making an autoantibody and attacking ourselves? So I'm pretty excited to see how that plays out. And our own patients will be collecting samples, storing them. And as the science develops, we can go back to our own incredibly carefully characterized cohort and start to test, are there biomarkers and things like that. So I think the science going forward is going to be really interesting. And we're prepared to then integrate that into the program.
Dr. Lipton, before we go, I want to pose the same question to you. Anything surprise you or anything really stand out as you began to do this COVID-19 research?
Well, I was somewhat surprised that when we studied a small number of individuals who had lived through at least the early phases of the pandemic, that in people who really felt they were okay, they really didn't have symptoms, we were able to see some measurable change in their brain. And we're using some very sophisticated quantitative measures to look at the brain with MRI and to look at people's brain function with cognitive tests. And it's remarkable because when we think, as Dr. Daly had said, when we think about something like the flu, while influenza could certainly be deadly, the people who survive and get better. We don't really see in general that they have long-term effects, especially on the brain. So I think it's quite interesting that this virus seems to be not just the flu, as some people like to say. There really seems to be something else to it. It also is, a little bit surprising to me that as we go on over time, it's still really not clear what is going on in the brain. That something is going on, I think people are beginning to understand, but exactly what it is it the infection? Is it just inflammation? Is it a stress effect? We really don't know. And that's really why we're targeting a lot of these cutting edge methods to try and not just detect the changes, but really figure out what's the mechanism, what is happening in the brain, because that can lead us to think about ways to treat people.
Dr. Johanna Daily, Dr. Michael Lipton, thank you so much for your work. And certainly we'll be following back up with you to find out what you've learned and what we can tell Bronx residents and the residents across the city. Thanks so much for being with us.
Thank you, Daren.
All righty. Well, I want to let you know if you want more information, don't hesitate to visit the website at einsteinmed.edu and then also on Twitter and Instagram at Einstein Med. We encourage you don't go anywhere. We do have more show coming up. Open continues right after this.